Hello, everyone. So I'm Alison O'Connor, and today I'm going to be walking you through one of the recent projects that I've conducted with Angela Evans at Brock University. And in this project, we wanted to assess how people evaluate the morality of health lies that are told by older adults. And so, especially in this group, we all know that lying is a common and global social behavior that emerges quite early in life and persists across our lifespan. And in the field, we've really explored how these lies can impact us in our social network, in our friendships, how lies can impact us in our romantic relationships. A lot of research has explored lie telling within a legal context. And recently, I've been really interested in exploring lies within a health context. So how might lying occur in a health context, and what are the implications of this? So to begin, I just want to kind of set the stage of thinking about health communication and the role that deception might play in this setting. So if we think first about kind of the intention of communicating about our health concerns with others or with healthcare professionals, the ultimate goal is that, let's say, we would tell a doctor about our health concerns so that they could then understand our behaviors, our concerns, and then use this to promote our health. So in an ideal health communication scenario, we would have a patient who just shares all of their health information honestly with their doctor, and that shared information can then be used by the doctor to help that patient and their own health. But some research suggests that this may not always be the case. So patients may not actually always honestly disclose all of their health behaviors. And so lately I've been thinking about kind of these psychological barriers that may prevent this honest flow of communication from patients. And so some of these psychological factors may be, you may be more reluctant to disclose your health information if this is associated with certain stigma, or you feel like you'll be stigmatized if we're reporting certain health experiences. If you feel ashamed of your health behaviors, that may lead you to be more reluctant to disclose them. And sometimes discussing your health and your health concerns can make people feel vulnerable. And so lies may be used as a way to avoid those feelings of vulnerability. And some past research has started to look at health-related lying and has found that this element of shame seems to be quite important. So individuals have reported that they feel ashamed of having certain health concerns or negative health behaviors. And in one interesting study in 2009, Harris and Darby found that 50% of patients said that they felt ashamed of themselves when they were interacting with a physician, and that 16% of these patients then lied to the physician to avoid feeling ashamed. So again, suggesting that this lie may be used as this coping technique to reduce this feeling of shame. And so one thing that I've been thinking about with this element of shame and lying is that this may be problematic in that you may get stuck in this shame cycle, where if someone has health concerns that evoke feelings of shame, and then you use secrecy or concealment strategies to mitigate the shame, that may then prevent you from getting access to treatment or supports to help your health concerns, which may worsen your health, which may evoke more feelings of shame and more secrecy, and so on. And so I think it's important to look at how we can promote more open communication in this context. And in my area of research and the focus of the project I'll talk about today, I'm particularly interested in exploring health communication in later life by older adults. And some prior research has started to look at older adults and their concealment of health information. So there was a small case study done in 2016 where they surveyed 8 older adults who had just been in the hospital for a cardiac procedure. And then they got discharged from the hospital and they were interviewed 3 weeks after to understand how this transition after the hospital was going for them. And they found elements of concealment and lying from these older adults after being discharged from the hospital. So some things that were reported is some reported that they were concealing difficulties that they had throughout this recovery. As well, some older adults reported lying to their doctors and their spouses about to conceal activities that they weren't supposed to be doing during recovery. And there were common themes of ableism and independence as motivators for why these lies were told. They wanted to make it appear that they were able and independent during this transition after their hospital stay. And so, thinking about older adults specifically, I think it's really important to explore their communication about health and how lies may play a role in this, because the complexity and prevalence of health concerns does increase with age. So, with Canadians over 65, it's estimated that about 75% of them have a chronic health condition. Older adults tend to visit their doctor more frequently, get admitted to the hospital more frequently, and they have more complex medication needs than younger adults. And so altogether, what this may suggest is that communicating about health may be more prevalent among older adults. And so I'm really interested in understanding the role of dishonesty within that context. So that brings us to some results that I'll present on today. So this is a study again with Angela Evans, where we have research that's starting to look at how often people lie about health. So we wanted to look at how are these lies morally evaluated? So do people perceive these lies really negatively, or is this something that people think is more acceptable? So to answer this, we conducted a study where we surveyed a group of younger and older adults, and they assessed the morality of older adults' health-related lies. So specifically, participants read a series of health scenarios where in each scenario, there would be an older adult story character who told a lie about some health topic. So these scenarios, some of them were about physical health. So for example, telling a lie to conceal your hearing decline. Some were about mental health. So for example, experiencing depressive symptoms, but lying about this to others. And then one story was about your medication use, which depicted someone lying about not adhering to their medication plan. So then in each of these scenarios, the participants were asked, how good or bad is it to tell a lie in this situation to the person's adult child, to their spouse, and to their doctor? So we were really interested in looking at if our expectations or our moral acceptance of lying differs across these different social contexts. And then you can see our rating scale here, so they could rate this from very bad up to very good. So I'll kind of take you through some of the main results that we found here. And the pattern of moral evaluations across our physical health and mental health scenarios were quite similar. So we're going to look at them together. And so what we'll be looking at here is the mean evaluation rating given to lies told to doctors, spouses, and adult children. And so this is all kind of the negative, the bottom part of our scale here, of -3 being this is a very bad thing to do. So this is what we found, and I'll kind of walk us through a few different parts of these figures. So the first thing that I think is important to look at here is just that all of these lies were rated quite negatively. So this is -3 is, very bad rating. These were all of these health lies were depicted to be quite bad for these older adults to be telling. But we do see variation depending on who the lie is told to, where across both of these lie types, lies were rated most negatively when they were told to a doctor, followed by a lie to a spouse, and then lies to adult children. They're still rated negatively, but they were seen as a little bit more acceptable. And then lastly, we also found some age effects. So in the graph here, the older adult participants, their evaluations were in blue, and the younger adults are in gray. And first, when looking at our physical health lies, we see that younger adults provided more negative evaluations of that lie. But interestingly, across both these physical and mental health lies, we see that older adults rated lies to their adult child more negatively than the younger adults did. And I think this is interesting because in this context, the younger adult participants are essentially the adult child that would be lied to by their older parent. And they viewed this line from an older adult parent to be slightly more acceptable than the older adults did themselves. And then lastly, we have the ratings of medication lies. This one, we just found this main effective lie recipient. But again, following the same pattern, lies to a doctor are rated the most negatively, followed by lies to a spouse, and then lies to one's adult child. So a main conclusion to take away from this study is we can see that these health-related lies are rated quite negatively. So adults do not perceive this as a morally acceptable thing to do. Although our perceived acceptability does seem to differ depending on who that lie is told to, with kind of the most acceptance to an adult child and the harshest ratings were given to lying to one's doctor. So I'll just leave us with a few broader take-home messages and some thoughts of next steps for this research. So first, I think it's interesting that we do have evidence that adults tell health-related lies. So people do tell lies, although these lies are perceived to be quite negative. And this is a common theme within lie-telling research where we typically evaluate lies as immoral, yet we continue to tell them. And this seems to be the case in a health context as well. And then I think this kind of how lies were rated the least negatively to adult children suggests that possibly older adults may be more willing to lie to their adult child about their health than, let's say, their doctor, given that pattern in the moral evaluations of these lies. But that's just a speculation at this point because we only know from this study how they morally evaluated this. So I would be really interested next to explore rates of lying within these relationships to see if the pattern corresponds to these moral evaluations here. So thank you very much and happy to discuss.